I tell all the new members, the young new members, I said I was on the single payer bill before it was cool. Okay, so we have got to move in a direction where we have some public option for people. I supported the public option during the last healthcare debate that we had, pushed really hard for it, but couldn't get it done through the Senate, and just couldn't. But we've got to have a public option for farmers, for small business people, for families who can't otherwise take care of and find affordable, accessible health care. We have to do it. We've got to make sure we have robust mental health care. That is a huge issue in the United States today that goes really undetected and untreated in so many different ways. That's why the social and emotional learning piece is critical, making sure our kids start building some of these resiliency skills to promote mental health and mental wellness. But I do think we're having the wrong conversation. We're having a conversation today around a disease care system, a sick care system. And we have the pharmaceutical companies and the healthcare companies sitting in the middle saying, how can I get paid? And they make money off of disease. And insurance companies. 75% of healthcare costs today are from chronic diseases that are largely preventable. And yet we don't even talk about it. We talk about single payer, public option, private insurance. It's like half the country now has either diabetes or pre-diabetes. And a diabetic, type 2, costs 2.3 times as much as a non-diabetic. That's going to sink the healthcare system. I don't care what system it is. It's going belly up. But we can't sustain that. We need to move from a sick care system to health care. And that means health, and that means food, and that means talking about how highly processed our food is. And that gets back to agriculture, to make sure our farmers are actually producing food that is real food. Not, it's like, they call it a specialty crop, right? Like, specialty crop? It's tomatoes. It's like, I mean, I'm half Italian, like that wasn't special. You know? That's what we did. We grew tomatoes in the backyard, lots of them. Ate them every day. But that's how screwed up the system is. So what I want to do as president, one, you definitely need the public option, but we've got to start incentivizing doctors, patients, healthcare systems, insurance companies to keep us healthy. It needs to be a partnership in our schools about how we stay healthy. You want to kneecap the pharmaceutical industry? I like everybody wants to, like, we're going to do this to them, we're going to do that to them, and maybe some of that's necessary. You want to really kneecap them? Don't get sick. Like, let's stay healthy. You'll screw the pharmaceutical companies like crazy. They won't know what to do. And that, to me, needs to be the mentality. We're having the wrong conversation. I have a bill called the Enrich Act. We have in our medical schools where 90% of doctors don't feel comfortable teaching their patients about nutrition. So my bill provides some revenue for the medical schools and mandate, not only the mandates, but it makes them teach the requisite amount of nutrition education to our doctors so that they can be partners in keeping us healthy. And if you do keep us healthy, the doctor should be rewarded. The incentives right now are like, get sick and you get paid as a doctor. And if you keep getting sick, you keep getting paid. And that's no way to run the healthcare system. And if we can get and have a national conversation around food and around health and around wellness, we will shift this conversation. And we can do it. This is doable. We spend 2.5 times as much as every other industrialized country in the world, and we get the worst results. Now, I would say, if we spent 2.5 times as much as everyone else in the world and we got the best results, I'd say, well, you know, I mean, we are getting the best results. Maybe it works. We get the worst results, which tells you that this system is really screwed up. So what I'm going to try to do over the course of this campaign is really shift the conversation from healthcare to health and food and prevention. And I think that's where